You know, a lot of people know me as an actress who just happens to be deaf. My vision is my #1 means of access.
Hi, Marlee. Got a big cataract.
What?
So you're a good candidate for cataract surgery. Based on the preliminary testing today, you are legally blind in that left eye.
Today is surgery day.
We want her to look towards me, so let's see if this prompt works.
Deaf since the age of 18 months, actress Marlee Matlin has relied hugely on her vision to live her life. But recently, she was at risk for losing her gift of sight. We're here with Dr. Kerry, who performed the surgery to fix Marlee's cataracts. And she's here with us today. Let's go ahead and bring her out. Please welcome Marlee Matlin. Woo! Nice to see you. Welcome back.
Nice to meet you, right? Jack just told me.
And everyone,
I'm just going to give you a hug. Nice to meet you.
Jack, who we've all met before.
I love it.
So, Marlee, we can assume by the fact that you just did this towards Dr. Assil that everything went well?
He is the rock god. Because of him, my vision is amazing. It has 100% improved. 100%. My life is back. Woo! My life is back.
And Marlee, you rely more on your sight than most other people because you...
Absolutely, absolutely. I mean, I have no hearing, clearly, so my vision is my #1 sense, to be able to access the world, to be able to function, to be able to communicate, to be able to be the mom, to be able to be the person who works, who drives to work. It is my world through my eyes.
But you were delaying this,
Yeah.
and yet you're so dependent on it.
Big time. Big lesson was don't do what I did. Don't do and delay what I did.
So we...
You know, I heard the story, and Dr. Assil, I think more cataracts as somebody a little bit older. I mean, this is a young woman, right?
I'm old. I'm old. No. Actually, it runs in my family. It's hereditary. I don't know if that necessarily means. Is it hereditary, Dr.
We used
Assil?
to, yeah. Well, we used to think of cataracts as occurring in older people. We're finding now that about 1/3 of the patients that we treat with cataracts are under the age of 60, maybe even a higher percentage than that. We're not sure exactly why, whether it's environmental in the foods we eat or more UV exposure, or if people's demands are greater in society, computers and driving cars at night and so forth.
And you have a demo over there, Dr. Assil. Again, everyone remember, cataract is the leading cause of blindness in the world. This is a big deal.
So normally, the light travels through the eye because the contents of the eye are transparent. They focus onto the retina. And in somebody with a healthy eye would look like this, where the lens in the eye would be transparent, such as this. But when this lens loses its transparency, we develop what's referred to as a cataract. And in that case, the lens starts to look more like this and starts to blur the vision and block the vision, causing some double vision, some loss of color saturation, and eventually can become so dense that all you can see is light traveling into the eye.
We have a little still here I want to show people. This is what you might see if you have a cataract. And again, it depends upon the extent of that cataract. And of course, it can lead to complete blindness, right, Dr. Assil?
Yes, as it gets more and more extreme, people can have double vision. Decreased night vision is a very common concern. Difficulty with reading. Early symptoms are they turn on the lights brighter in order to be able to read and so forth. So they start to get a sense that something's not quite right.
And he's right. I mean, I had the blurry vision. I had the inability to drive at night, even like to pick up kids from soccer. I mean, I had to depend on somebody else to drive me. And I would trip a lot because I had problems with depth perception, too. And, you know, if you feel any of these things happening, go to see a doctor. Have it taken care of right away.
And it's really important because what Marlee said is true, is if you wait a long time, you can actually develop other injuries. It could be falling down the stairs. It could be getting into a car accident. So get your eyes checked regularly. Marlee, we're so happy you're doing well. Dr. Assil.
Thank you. Thank you.